serious. Shut up, man.
These are my sons, and they are going to be my audience for my informative speech. I want to introduce you to Neville Strump, who is a professor of the University of Pennsylvania. He was involved in a 4-year study that included 375 elderly patients who had cancer. They went in the hospital, they had surgery, and they were discharged home. Now, about half of these patients receive the standard care after somebody is discharged from the hospital. The other half, which happened to be the sickest of all the patients, receive specialized care from advanced practice nurses. Now, you would have thought that the sickest would have passed away sooner, but actually what happened is they lived 7 months longer. Traditionally, nursing is thought of a profession that makes you more comfortable, improves your quality of life, but this study showed that good nursing can also extend life. This study linked the improved survival of the post-surgical cancer patients directly with the advanced practice nurse care. So I want to introduce you to an advanced practice nurse, also known as an APN, or an advanced practice registered nurse, which is an APRN. They're one and the same. They're used just like each other. They are both RNs who've completed graduate training as a clinical nurse specialist, a nurse anesthesiast, a nurse midwife, or a nurse practitioner. So I'm going to tell you a little bit about their education, a little bit about their specific roles, and their role in healthcare. The education that they each require is specific to the state that they live in, specific to the Nurse Practice Act. Most of them require you to have a BSN, and the education requirement for each state usually coincides with the national certification agencies specific to the scope of practice in their APN role. Now let's talk about the 4 roles a little bit. The clinical nurse specialists, they have earned a master's or a doctorate from a program that prepares them. According to the APRN consensus model for regulation, the CNS has a unique APRN role to integrate care across the continuum and through 3 spheres of influence: patient, nurse, and system, with the primary goal of continuous improvement of patient outcomes and nursing care. Now, a nurse anesthetist is an APN who administers anesthesia for surgery. A nurse midwife is specially trained throughout the entire aspect of someone's pregnancy. Usually these people are low risk for complications. The nurse practitioner RN clinical education is beyond that of the generalist role. According to the International Council of Nurse Practitioners, an APN is a registered nurse who has the acquired knowledge, base, decision-making skills, and clinical competencies for expanded practice, of which will be determined by the context in which he or she is credentialed to practice. In other words, it really depends on your specialty, but you could be an advanced practice nurse of neonatal or babies, all the way up to geriatrics, which is, of course, the elderly. Part of being an APN is your autonomy, and the definition of autonomy is the ability to self-govern, to make your own decisions separately from others. The role of autonomy in APNs is not a clear path. Nurse Practice Acts differ from state to state, so does the autonomy that they give them. California appears most liberal. Their Nurse Practice Act defines nursing practice as care that promotes health and requires significant scientific knowledge or skill, including patient care and other procedures ordered by physicians. Another state, Texas, they specifically state that APNs perform acts delegated by a physician. Well, we all want to know what Missouri says because we live there. Missouri actually has a collaborative agreement where you have an APN and a physician and you have in writing everything the physician allows you to do. The only stipulation that they have with that is you must work with them continuously for 1 month before you work by yourself. The advanced practice nurse's role in healthcare is very important. According to the American Nurse Association, APRN, whether they're a nurse practitioner, a clinical nurse specialist, a nurse anesthetist, or a nurse midwife, they play a pivotal role in healthcare. APRNs are often primary care providers and are the forefront of providing preventative care to the public. Their role in healthcare is not going to be easy because doctors for so long have been the number one. They delegate, they say what's going on. But because of the rapid growth and success of the APM movement, it's been described as a disruptive innovation in that APNs in many ways provide the same care or better care than physicians at a lower cost in a more convenient setting. And that is according to an evidence-based handbook for nurses. APNs currently have a role in healthcare. They are a part of the Affordable Care Act, which makes provisions for the care APNs provide, and that they can provide care at home independently, and also they increase their reimbursement from Medicare. In conclusion, I would like to leave you with this. According to Furlong and Smith, who are forerunners in advancing the practice of nursing, the core concepts for the advanced nursing practice role are autonomy and clinical practice, pioneering professional and clinical leadership, expert practitioner, and researcher. To achieve these core concepts, the advanced nurse practitioner must develop advanced theoretical and clinical skills and meet the needs of the client, the family, and the community. As we who are nurses want to further not only our careers, but also the quality of care that we provide, we must be involved in shaping the scopes of practice, autonomy, and health care. Thank you.